Hello, Facebook. We are here today to highlight yet another program at Mercy College. My name is Andy Gress. I'm Director of Enrollment Management, and I'm joined with Dr. Janine Matz, the Program Chair for our Health Sciences program. I'm really excited today because I think we're going to talk about a real gem of Mercy College, and I'm confident that someone's going to watch this today, and if not them, they're going to know someone that this program is a perfect fit for. So Dr. Matz, I'm really excited to explore your program, to talk about the student experience, some of the preparation that students do when they're working with you for graduate school and med school. But let's start with you first. How long have you been at the college? What are some of the classes that you teach? Let the audience know a little bit more about you.
Well, thank you very much for having us here today. I have been at the college for 25 years and have been the chair and the advisor of the health science program since its start. I teach anatomy, physiology, pathophysiology, med-term, practicums 1 and 2, applied research, research methodologies, med-term, so a variety of classes.
Well, it sounds like if we can't find you in your office, we'd be able to find you in a lab somewhere.
Absolutely.
Well, let's start with our the outline of the program. Our Bachelor of Science in Health Sciences is a preparatory degree or education for students that are looking for the next step, whether it's graduate school, medical school, really expanding beyond a bachelor degree. So the program can be completed in 8 semesters if a student comes to the college with no prior learning. But then there's also a lot of plug and play with transfer students, tracks you develop. So, tell those watching kind of how the program works and what pathways students can take.
Sure. It is a Bachelor's of Science in Health Sciences. So it is laying the foundation for all graduate programs. It focuses on health sciences, which is different from being a biology major or a chemistry major. With a biology major, you do indoor and outdoor biologies as requirements. We really focus on the health science piece of it. So not that we don't value biology, we do, but we really want you to have those health science courses of anatomy, microbiology, pharmacology, etc. And so, yes, we do offer a 4-year or 8-semester program, but we can do it in much less than 4 years. So we have 3 semesters a year, so fall semester, spring, and summer semester, and they run the full length of the semester. So again, we can move and schedule according to each student what fits best for their lifestyle and what they want to do and how they want to accomplish it. So we can finish much quicker than 4 years. And we have a variety of different tracks to individualize for each student to kind of fit what best they see themselves going into in the future.
So just to dial back a little bit, students they have lots of choices, right? We're sometimes one choice of many. And really our program is distinctive in that, as you said, the experience that someone may get at another institution really exploring a hard science education. It might be in biology, it might be in chemistry. It's so focused on one area that when you look at our curriculum, there's a pocket of biology, there's a pocket of chemistry, there's a pocket of anatomy and physiology. So, just in your experiences, when you see students move on, what kind of feedback do you get when they say, hey, Dr. Matz, everything's going great. I'm so happy with the education I got at Mercy College.
Mm-hmm. I think it's, we get a lot of that just because we have worked with graduate schools to make sure that we have the right courses. So everyone will have an anatomy course. Everyone will have a biochemistry course. Everyone will have physiology, microbiology, pharmacology in graduate school in the health care area. And so therefore, we really want you to have a foundational course in all of those areas so that you're not going to graduate school and learning a course at the graduate level for the first time. And so knowing that, we have laid the first 6 semesters, as every graduate program would want these courses. And that gives the student then the ability to diversify in their tracks. If they say, I want medical school, but then they change their mind and want to go to occupational therapy, or they want to go to pharmacy, they can do that and have that ability to make a switch. So you're not locked in to a certain graduate education from the day one. You can actually explore those opportunities throughout your curriculum.
This is a good transition point because I really want to talk about the student experience and how personalized it is. Certainly in your program, students aren't a number. They have a different experience where you are their advisor. So tell listeners just how you work with students, kind of the semester to semester, and how you help manage not only their academic plan, but their future planning, kind of a dual pathway.
Yes. So yes, as the program chair, I do meet with each individual student every semester, and we try to map out at least 3 semesters out on their curriculum and what their plans are. And life changes, so we're not locked into that, but it allows for us to be able to let the student know, as well as myself, planning for what lays ahead. And that being individualized, again, a student doesn't have to be full-time, they can take semesters off. So that allows for some flexibility if they want to work in the summer or they want to go part-time in the fall, they got a big event coming up, we can work with that flexibility and work it for each individual student. But being the program chair, sometimes we come in and we only want to be a nurse, or we only want to be a physician or a PA. And then as we explore, we find out there's other opportunities out there, such as medical laboratory sciences, or talk about occupational therapy, or the biomedical sciences, or public health. So there's lots of graduate programs, and we want to be able to explore and still have those opportunities for each student. So we've built tracks into our program that allow for us to diversify and say, your senior year, you will no longer be taking science courses, you will be moving into medical laboratory sciences, or you'll be moving into nursing, or you'll be moving into occupational therapy or pharmacy. So again, that actually gives some students some flexibility when they actually, are in our conversations together.
And at the beginning of our webcast here, you listed a litany of classes that you teach. So you're working with the students really throughout, not just as their advisor, but you see them a lot in the classroom. And a lot, we just have a smaller amount of faculty working with this group. So the relationship that's developed is so much stronger than being somewhere where you have someone different every semester, different subjects. And really that the relationship develops into something deeper. When students are looking to go to graduate school, oftentimes letters of recommendation are required. And I think our students just get a different experience with you and with our other faculty because of that closer relationship.
Yes, I agree 100%. We have a small class size. We usually try to keep it around 10 or less. So we really want to get to know the actual individual student, because again, recommendation letters will be required for graduate programs. And again, we don't want you in a class of 400 and not know you. We want to really know, do you attend school? Do you take notes? Do you do well? Do you ask, innovative questions? Are you really engaged in the process? Do you really, just really get to know you and provide opportunities for you? So we also have research opportunities. We know that it's very important for you to actually present your research findings and do a presentation. So having opportunities to basically build your portfolio from the moment you arrive, because again, that is a whole process of showing your leadership, your research, your immersion experiences. So yes, we've taken students to Merida, Mexico, for example, to show urban and show rural healthcare in Mexico. We went to London and Scotland and showed healthcare in universal healthcare. So just really giving the student opportunity to really develop themselves, be able to have the ability to serve others, and really having different experiences here.
So I know from my own personal experience, I got to my senior year and it was like, what is going to happen next year? What am I going to do? And I really started exploring graduate school within my last year of study. But the relationship that students have working with you as their advisor, just that kind of throughput throughout the program, our students they're focused on that from the time they get here. So,
Right.
you know, the preparation and that they have is just, it's different.
Right. And when you basically look at graduate school, and especially for those that are in the healthcare, you really do it your junior year. And so again, to be in preparation for that, to be building and making sure you have the biologies, the chemistries, the physics, all those taken care of, and time to study, and then take your MCAT or your GRE or your DAT, whatever test you need to take for entrance into graduate school. You will take that at the end of your junior year, and then apply for graduate school in the summer of your between junior and senior year, and then you interview in the fall for all programs. So it's really a year out that you actually apply to graduate school. And sometimes we have to plan all of that out as far as if there's going to be any gaps in there, what are we going to do with that? Or are we going to work clinically and get some clinical experience? Or are we going to do a master's program to fill in that year? So again, we really want to make sure that we understand the process for graduate application and the lengthiness of the whole process.
So I already said it, but I'm going to say it again. I know that someone's going to watch this, and if it's not them, they're going to know someone who is looking for a different experience, is looking for more support, is looking for a smaller classroom, is looking for a more personalized experience. Because, I mean, let's face it, it is kind of scary looking at graduate applications, trying to, you know, assess where you think you can get in, maybe where you're maybe mid-range, or where you're trying to apply that you know, feel like you would get in, and doing that alone, I can't imagine, you know, students coming through college and having to navigate that. So as you're doing that, you know, what do you find that the student reaction is when you're really teaching them about the process of taking the next step?
I think one big thing is that, you know, our program and the students that are in it all want to go on to graduate school. And our grading system is such that it's 93 and above is an A, and 90 and above is an A minus, et cetera. And so everybody in the class can get, you know, all A's if that was where everyone landed. It's not on a curve. And so everyone is very supportive of each other. So I feel like there's a lot of peer-to-peer help, as well as chair to student help as well. And students are studying together for the MCAT. They're centralized applications for graduate school. And so the whole process of when things open up, I'm always sending out emails to students to allow for them to say, here's University of Iowa, here's Des Moines University, and what their process is and how, you know, it works. And if you have questions on where you're at, or if you're confused at all on the application process. So we really kind of work collaboratively. And I think it's a very collaborative program with the students that are in the program as well.
So we've touched on the support, which is fantastic, but there's also academic preparation. You know, our students in the program take advanced anatomy, they take histology and embryology, and from what you've told me, because I wouldn't know, you know, that combination is, you know, it's maybe unfound in, you know, other programs that are preparing students to go to graduate school. So, you know, what's the student experience like in those two classes, and what kind of things are they learning that give them really the upper hand when they're in their first semester or two of graduate education?
Right. So we have like a lower level anatomy, and that is taught in systems. So you'll learn about the muscles and bones, et cetera. But then you get into advanced anatomy, and that is with cadavers. And so again, it's taught in regions, and that is way different, much higher critical thinking skills. And that's the level that's taught at medical school, PA school, et cetera. And so therefore, to basically assume that you've had anatomy at the systems level, it's a challenge to change that and learn all the arteries and nerves and muscles and structures of the head and neck only and how they all fit together. So that, plus putting in histology and embryology, that is also a piece of graduate level anatomy. And so again, we really want students to have a very in-depth courses that start them off well, because all graduate programs start off with biochemistry and anatomy. And so having very thorough and having had graduate educators looking at our curriculum to make sure they're prepared, that is been key as well. And so they know what our curriculum's like, they know it's rigorous, they know that, again, it's robust, and that's good, because that's what you need to basically be successful at graduate school.
And I don't want to leave out research methods, because you teach that as well, right? So,
yes.
You know what, I mean, that's a extremely important component as students are getting ready to, you know, to move on.
Right. And no matter what you go into, I mean, having biostatistics and being able to understand the statistical analysis, and then learning about quantitative and qualitative, and then moving it to the third class of applied research and doing a research project. And we've collaborated with Des Moines University and other institutions to allow for various experiences, as well as here, to allow for our students to have the type of research opportunity that's best for them. And they can do research throughout the curriculum. So again, there is a class for research, but if a student has an interest in it, they can do that as well.
So I bet by this point, people watching are saying, this sounds great, but is this for me? You know, let's talk about the why Mercy? You know, what do our student demographics look like from students entering, you know, out of high school, transfer students, people maybe transitioning careers that come in? I mean, you know, what do our students look like?
We're very diverse, as far as we definitely have students coming right out of high school, but we definitely have transfer students or students that have a full associate or a bachelor's degree and need to come back and pick up courses. And we kind of lay out a plan for them as far as what do we need to do to help you get ready for medical school. So definitely have a variety of students of very diverse backgrounds. And that's why it's very individualized, because again, there isn't a cohort coming in and everyone has to take this. It has to be set up one-on-one to kind of fit the actual student's lifestyle, where they're at, and what curriculum they actually need. So that's been very helpful for us.
So from Mercy College of Health Sciences, where have students gone on to do graduate education?
Actually, they've gone all over the country, and actually internationally. We have a student in Ireland going to medical school. So again, we've had everywhere from Virginia to Florida to Arizona, South Dakota, et cetera. But we, you know, have a high concentration at Des Moines University. We've always had a student in the entering class of Des Moines University, and University of Iowa, as well as the two major graduate schools for healthcare.
I bet it's been, you know, just really personally gratifying over the years, seeing, you know, students that you can remember from the first day of class that, you know, just looked like they were nervous or, you know, had anxiety, and not, you know, now they're a medical doctor, they're a physical therapist. I mean, they've, you know, and just the evolution of from being in the classroom to going to graduate school to practice.
Oh, absolutely. I mean, and we have a very close relationship with students. So again, having them be excited to show us or tell us where they're at and what they're doing has always been rewarding. Because again, I think sometimes students don't realize that when you go to graduate school, like medical school will be, you know, a 4-year commitment, and then you have to do residency. So again, another 3 years. So definitely like looking at the timeline. Whereas PA school, they want you to have clinical experience. So you have to be a CNA, or you have to be working in the hospital in some type of healthcare environment, be it a nurse or whatever it may be. And so having those conversations to say, you know, because you are a CNA and you are working, this could open the door now for PA school as well as medical school. So letting people know of their opportunities, I think that's been very rewarding, you know, as we travel the path together. So
we're kind of nearing the end here. I I want to end on a fun note. What's it like when you get contacted by a student that just got accepted?
I'm as excited as they are because they are super excited, and then I share it with all of the faculty because you can hear a round of cheering when that happens. And so then there's all kinds of accolades because it takes a team to actually have acceptance to graduate school. So I'm proud of all the faculty and all the students and all their hard work because it takes all of us.
So I've been looking forward to this because I really think that this program it's a hidden gem at Mercy College of Health Sciences. The student experience is so different. It's so different from working with fewer faculty to, like you said, having a smaller classroom that's even competitive, individually, because everybody is looking toward what's next. And, just hearing from you, the preparation that students have, you're not finishing and then saying, well, what do I do now? You really live on a dual path at Mercy College, your academic path, and then your preparation for what's next. So
Right.
I'm for people still listening, I'm just excited that I know it's going to get shared. It's going to get shared. People are going to say, hey, this program at Mercy College is a right fit for you because the student experience is great, academic preparation, the preparation for graduate school. So just a complete package. Again, Program Chair of Health Sciences, Dr. Janine Matz, thank you for joining. For all of our followers, again, highlighting another great program at Mercy College of Health Sciences. I'm sure we'll see you back on soon. Have a great day, and thanks again for joining.
Thank you.